Hi, my name is Cindy Ellis, and this video is a presentation done to the Berrien County Democrats Healthcare Task Force report. It's an analysis of the American Health Care Act designed by the Republicans to replace the Affordable Care Act. For purposes of this presentation, we're going to call it the American Horrible Care Act. Both the American Health Care Act and the Affordable Care Act, Obamacare, were designed to provide access to Americans to be able to purchase health insurance. Both are federal programs designed to guarantee that you can buy a health insurance plan, which is something that didn't exist before the ACA. Under the ACA, the goal was to get everyone covered by health insurance, whether it's an employer, individual, or government program such as Medicaid or Medicare. Under the American Horrible Care Act, the plan is to allow people to be able to buy a policy if they want to, but not be required to do that. A little bit about insurance companies. Insurance companies are in the business of making money, period. Insurance policies are a product. They pay some of the dollars for medical expenses and usually a discounted network. Insurance companies employ some of the smartest people in the world. They're called actuaries, and they calculate the risk meticulously to make sure that that happens. If they lose money or don't make enough money, they change the contracts or the plans. They do this whether it's a group plan or an individual plan. And insurance companies change and adjust healthcare plans every year, and they always have. A little bit about my background. I owned a health company that worked with and for every major group insurance company in the United States for 20 years. I also was an employer, so I bought healthcare plans for my employees. I have two family members who rely on their health insurance through the ACA on exchange and non-exchange plans. To do this analysis, I read the ACHA, the CBO report on the ACHA, and the Kaiser Foundation analysis of the ACHA. Following are some major points of the American Affordable, or the American Health Care Act, or the American Horrible Care Plan, as I like to call it. The good news is it keeps the prohibition for exclusion of pre-existing conditions. It allows dependent of child care up to age 26, no lifetime max on benefits. It maintains the 10 essential health coverages, including maternity, mental health, and premiums are not set by the health condition of the insured. It does eliminate the individual mandate. People who don't have to have health insurance, employers don't have to provide it. The AHCA imposes a 30% premium penalty for buying insurance after a lapse of coverage. The plan changes the premium support. It modifies the tax credits based upon age and not income level. Older people are going to have to pay 5 times more than younger people for insurance. It lowers the tax credits for buying insurance. $2,000 for those up to age 29, $2,500 up to age 30 to 39, $3,000 up to age 40-49, $3,500 age 50 to 59, and $4,000 for those 60 and over. Tax credits can't be claimed for any plan that covers abortion, and it totally eliminates the cost-sharing subsidies in 2020. It also repeals the taxes that funded the ACA. Health insurance taxes on high earners, fees paid by drug companies, eliminates the tax on Cadillac health plans, eliminates the 3.8% earned income tax on high earners, the chronic care tax, the tax on tanning beds, tax penalties for being uninsured for individuals and employers, the tax on health insurers, and reduces penalty for health savings accounts, non-medical withdrawals. The plan also reduces actuarial value requirements for plans. Plans can be designed with much lower coverage coinsurance limits. The ACA requires plans at minimum coverage of 60% of the expense. The ACHA does not. It also eliminates all funding to Planned Parenthood, period. 15% of people will lose access to care provided by Planned Parenthood. With respect to Medicaid, this rolls back the federal reimbursements on Medicaid expansion. Currently, the federal reimbursement is 90% of Medicaid expansion cost. With the ACHA, reimbursement will be between 50 and 75%. This effectively eliminates the Medicaid expansion. Under ACA, that's 138% of the federal poverty level, which is about $16,000 per individual. The fine print, Medicaid alternative benefit plans aren't required to have the essential health services such as mental health, maternity, prevention, etc. The American Affordable Care Act also repeals attendant care services for community first choice option, putting more people into nursing homes as they're not able to stay in their homes without attendant care. It also capitates Medicaid. So reimbursements from the federal government in 2020 will reimburse a per person rather than a per cost level for cost of services. The American Affordable Care Act establishes a patient and state stability fund, $100 billion over 9 years, that the feds give to states on a grant basis. States can use these dollars to offset premium increases, pay for insurance companies for high dollar claims, which is reinsurance, prevention, or other services that they deem necessary to implement the plan. States must apply for these grants and put up a 7% matching fund. This plan also increases the tax-sheltered dollars that go into the health savings accounts, increases it up to $6,500 per individual, and reduces the penalty for withdrawing for non-medical expenses. This is a tax break for people who have the discretionary funds to put into an HSA because these have to be funded upfront. Not included in this plan but coming in the next rendition will be selling insurance across state lines. This is a myth. Health plans and rates are based on local rates and experience in that local market. They're also dependent on negotiated discounts with local providers, i.e. networks. So if you live in Michigan, do you want to buy a cheaper plan in Nebraska and use the Nebraska provider network? This is a myth that the Republicans are trying to perpetrate on the public, that this will offset premium increases that will come with the American Affordable Care Act. What does this mean to the American public? Well, according to the CBO, Congressional Budget Office, we'll have less people insured, especially low income, working poor, older adults, and children. The lack of mandate will result in higher premiums, less Medicaid expansion, worse plans, and higher coinsurance. The CBO says that less people will be insured. In 2018, 14 million more people will be uninsured than under the ACA. In 2019, 16 million more will be uninsured. 2020, 21 million more uninsured. And in 2026, 24 million more uninsured. This plan also reduces the number of people eligible for Medicaid expansion by 5 million people. It reduces the Medicaid match from 90% to 57%, which disincents states to expand Medicaid, and existing states to reconsider whether they want to consider the Medicaid expansion. It also will result in fewer employers offering insurance. Also, higher premiums will occur due to the adverse selection. Higher out-of-pocket expenses such as deductibles and coinsurance will occur. Premiums will increase 15 to 20% in 2018 to 2019. Older people will pay 5 times more than younger people. Low-income persons will pay more of their income to buy insurance. And remember, insurance companies are for-profit entities, not social institutions, so they will design policies around this law. We will also see worse policies as the AHCA relaxes plan requirements that requires plan to cover 60% of medical costs. We'll see higher deductibles, reduced networks, higher copays, and higher coinsurance. Hospitals and providers will have more non-paying customers, non-reimbursed care, and we will see more rural hospitals close as a result of this. Of course, the plan includes tax breaks for the wealthy and corporations. It eliminates taxes, increases the deductions for HSAs, and increases the tax credit level for the wealthy. In a nutshell, the American Affordable Care Act is a cruel and naive substitute for the Affordable Care Act. It's cruel because the working poor, the poor and children and older Americans are the big losers in this. It is naive. The Speaker of the House, Paul Ryan, said so aptly, "People who are healthy are paying for the sick, and that's not right." It shows how little they know about how the insurance industry works. This plan is 100% supported by Fred Upton, who sped it through the Department of Energy and Commerce. This is a plan that we should not endorse and that we should oppose in every way. If you live in Michigan and Berrien County, there'll be a protest outside of Upton's office in St. Joe on Thursday at 4:30 p.m. Please be there.